VA ratings for neck pain require an accurate range of motion test of the flexion, extension, lateral flexion, and rotation of the head. Let's talk about 100% neck pain VA rating. Unfavorable ankylosis of the entire spine. Ankylosis means the entire spine is frozen. It doesn't move at all. 100% neck pain rating is a very high rating for an orthopedic condition of any kind, much less your neck. But if you have ankylosis of the entire spine, you can't move your spine. It's basically fused together. You have no range of motion. You have no flexion. You have no extension. You have nothing. Unfavorable ankylosis is a condition in which the entire cervical spine, the neck, the entire thoracolumbar spine, which is the mid to upper back, or the entire spine is fixed in flexion or extension, and the ankylosis results in one or more of the following symptoms. You have difficulty walking because of the limited line of vision. You know, you can't really move around, right? Restricted opening of the mouth and trouble chewing because of your spine. Breathing problems, gastrointestinal symptoms, shortness of breath or dysphagia, difficulty swallowing, cervical subluxation or dislocation, or other neurological symptoms caused by nerve root stretching. So that's the 100% neck rating criteria. A 50% rating for the neck and back. Unfavorable ankylosis of the entire thoracolumbar spine, which is T10 to L2, so it covers some of the lumbar spine and thoracic spine. This means your mid and upper back is frozen in an unfavorable condition. You have virtually no range of motion, but you have some. A 30% VA rating for neck pain, unfavorable ankylosis of the entire cervical spine, so your neck, or forward flexion of the thoracolumbar spine, 30 degrees or less, or favorable ankylosis of the entire thoracolumbar spine. This is something that is different for you guys. They call it the thoracolumbar spine, and they mix the thoracic spine and the lumbar spine together. So I have a lot of neck problems. I had an anterior discectomy with fusion at C3-4, C4-5. MRI revealed that I had problems, and then I also have a 10 millimeter herniated disc at L5-S1. So I'm used to talking about cervical, thoracic, and lumbar, but the VA calls it thoracolumbar. I don't know if that's right or wrong, but that's what it is. So another one of those things. If you're used to talking about thoracic and lumbar, now you combine them, because that's what the VA does. Yeehaw! Favorable ankylosis is a condition of fixation of a spinal segment in neutral position at 0 degrees. 20% VA disability rating, forward flexion of the thoracolumbar spine greater than 30 degrees, but not greater than 60 degrees. This is why that goniometer comes in, right? Because if it's greater than 30, but not greater than 60, that means it's in the middle of those two. Let's say it's 49 degrees. You don't want the doctor eyeballing that. These are little teeny measurements. So this is where the goniometer comes in. Forward flexion of the cervical spine greater than 15 degrees, but not greater than 30 degrees. Or the combined range of motion of the thoracolumbar spine not greater than 120 degrees, or the combined range of motion of the cervical spine not greater than 170 degrees, or muscle spasm or guarding severe enough to result in an abnormal gait or abnormal spinal contour, such as scoliosis, reversed lordosis, or abdominal kyphosis. A lot of or statements. So you could have this, or this, or this. So it's very specific, and you need to find out where you're at, get an MRI. That's the best way. An X-ray isn't going to tell you all this stuff. It'll just tell you what's broken and if it's way off balance or whatever. But an MRI will get in and actually tell you what these things are, and then get a goniometer on yourself and learn this, because, if you're like this, but you can only do this, or you just need to do this, that could make a difference between a 10 and 30, 50% rating. So it's good to understand how the VA is going to rate your neck pain, and then what you have to do to, get that point across. A 10% VA disability for neck pain, forward flexion of the thoracolumbar spine greater than 60 degrees, but not greater than 85 degrees. Or forward flexion of the cervical spine greater than 30 degrees, but not greater than 40 degrees. Or combined range of motion of the thoracolumbar spine greater than 120 degrees, but not greater than 235 degrees. Or combined range of motion of the cervical spine greater than 170 degrees, but not greater than 335 degrees. Or, kind of feels like a chant. Muscle spasm, guarding, or localized tenderness not resulting in abnormal gait or abnormal spinal contour. Or vertebral body fracture with loss of 50% or more of the height. And here's something you should pay attention to. The thoracolumbar and cervical spine segments are evaluated separately, except when there's unfavorable ankylosis of both segments. And then if that's the case, they'll be rated as a single disability. So understanding what's going on if you're filing a claim for neck pain, I guarantee you, we're going to talk about secondaries, but I guarantee you, if you have major cervical issues, you have lumbar issues, and you have thoracic issues. So you're going to run into like pyramiding where they're going to rate it as a single disability. And we're not trying to do that. We're trying to be clear and get all the ratings and all the compensation we deserve out of our neck pain rating. That strategy, that's my boot camp. That's what I talk about. I preach it and I teach it. You need a doctor that can help you with a Nexus letter. Check out my med team. Here's an email address. Hit them up. Tell them you need a Nexus.